One of the biggest components to a successful reform will be getting people involved in their own health care. What can they do to improve their own health? What can we all do to improve population health? Spending money in healthcare a little bit differently than we've done before. Focusing maybe more on how we are as a population and the health of the population and individual responsibility in improving your own health. And moving forward, that's where the biggest cost savers are going to be. I think the public needs to understand that every element, everybody involved with the system, including the patients, is going to have to come to the table with something that maybe doesn't feel great. There are certain things that we're probably not going to be able to have totally covered, or the copays are going to have to go up for certain items. If we open the door and had open access in America to all the services that we can provide technologically, we'll spend all the money, we'll spend all our money on healthcare. We won't spend any money on roads or on schools. Patients don't want to be told they can't get something. But again, the system should be set up to where they can get it. They just have to spend a bit more of their own money on it. Now, the health bill addresses our systems of care to try to start squeezing savings out of that by the way how we structure our healthcare system. But we've got a long way to go on cost containment. That's where we need to have a better conversation with the people of Colorado, the people of the United States, about where do we get cost savings from. We don't really address comparative effectiveness when it comes to healthcare decisions and where public dollars should be spent. We are not going to be successful in creating a more efficient healthcare system. The long-term liability of Medicare is in the range of about $38 trillion. So you compare that to the long-term liability of Social Security, $7 to $8 trillion. Medicare is a much bigger issue as far as long-term liabilities for this country than Social Security. We need to, turn our focus a little bit more towards, in essence, the prevention, but also the ongoing chronic care management of obesity, heart disease, asthma, and doing a really good job of taking care of that as an outpatient before anybody ever gets to a hospital. The bill didn't specifically address holistic care yet. We're still trying to see what's going to be included in the sort of basic benefit packages, which, they haven't determined quite yet. In the end, whether it's holistic care or traditional care, it should be all about the evidence. What does the evidence show? And if the evidence isn't there, then I would argue that maybe we shouldn't be spending a whole lot of public dollars on it. If the evidence is there, then, through good science, then maybe it's something that we should incentivize and reimburse for. And again, it's one of those areas where, just like with traditional medicine, we have to look at what works and what doesn't, because we got a lot of other things in this country and this state we need to be spending money on. I think the healthcare bill is a template for moving forward. Before, we didn't have one. Are there things that need to be fixed in the bill? Yeah. But we are now at a point where we're moving faster on reforming a system that needs to be reformed than we've done in lifetimes. And the blueprint is there. It will always have to be adjusted. 20, 30, 40 years from now, we're going to have to be making adjustments in how we deliver health care in America. There are things about this bill that need to be fixed, but in the end, it should not be repealed. It should be sort of repaired.